Different when we talk about workup breathing. What happens is we actually do auscultation also. We see or hear a different sounds, and every sounds probably tells you about something related to different kind of things involved, or different phases of the lung involved or parts of the lung involved. So let's see. So you have a different upper respiratory origin and lower respiratory origin signs. So when we talk about sounds in upper respiratory, and during examination, what we see is stridor or gurgles sound. Stridor comes from the upper part of the trachea. So I'm talking about this glottis, subglottic area. And usually when we see this kind of a indentation. We're going to see videos about it. Then we have a lower respiratory origins. In lower respiratory origin, you have airways and then you have a parenchyma. So when we talk about airways in the lower respiratory, what we see? We see wheeze, coarse crackles. And when we talk about parenchyma, actual alveolar parenchyma, we see a grunts, fine crackles. So what is grunt? So you might have seen in some kids, they try to breathe and they try to maintain their volume of the lung. At the end of expiration, we should maintain some volume of the lung because lung should be inflated. Because if I'm not able to maintain the volume, if it's an open circuit, what will happen? The air will go in, go out and come in. So there is nothing which is actually keeping the air inside the lungs. So basically the lungs air is kept by the glottis, the closure of the glottis. And if you are not able to keep it properly, then you start hearing the grunts like sound. That kind of a sound. We have a video. We are going to show you what do exactly mean the grunts. So when we talk about the sounds related to the upper respiratory and lower respiratory, what we see in upper respiratory, we see stridor, gurgles sound, which probably most of the time conducted sounds. Then we have a lower respiratory origin, which be airway or parenchyma. In airway, we see wheeze. So basically wheeze is seen in asthma, where the airways become smaller. So that's why we are not able to breathe out properly and we wheeze the wheeze sound. And then in parenchyma, we have a grunts and a fine crackles, which is coming exactly from the parenchyma. What kind of a retractions we see in the upper respiratory origin is suprasternal retraction. So suprasternal is here. It goes like this. And when we talk about the lower respiratory origin, we see intercostal or subcostal retractions, and sometimes subcostal, sternal, intercostal retraction. So there are different types of retractions. We are going to talk about it depending upon the retraction, how to differentiate between workup breathing. The other small different signs we see when we're talking about examination is in upper airway, we see a tripoid sign. Tripoid signs means basically they have a suprasternal retractions and they are not able to breathe, and they just put their hand and they are just trying to catch the breath. Head extended, so they are not able to maintain their airway, so they keep the head extended. Position drooling, so you have epiglottitis or upper airway obstruction, so you keep on drooling because you are not able to swallow. And dysphagia. So these are all features which goes in a favor of upper respiratory. When we talk about lower respiratory, you have a cough, sometimes silent chest, so you are not breathing in, breathing out, so like an asthma. So you have a complete kind of a closure of the airway, so there is no air going in and coming out. Then we have some other features in parenchymal involvement is fever. So basically you have a pneumonia, so you're going to have fever, and tachypnea, retractions, all those things. So other accessory muscles involved and other features associated with workup breathing, you can have use of accessory muscles like head bobbing, ali nasa becomes bigger, suprasternal retractions, you have supraclavicular retractions, all those things. Sometimes you can have cyanosis, the saturation goes down, you become irritable, drowsy, and you can have a respiratory failure. That means you are not breathing appropriately, so that you need some intervention.